Good day everyone, my name is Samira Marie Pipanga from BSN3 Block D and I am your student nurse for today. So today I'm going to perform a return demonstration about the physical examination about the comprehensive geriatric assessment, and here with me is Miss Kim Abigail Baid, assuming that she is a geriatric patient. So assuming that I'm washing my hands to avoid contamination. Good morning, ma'am. I'm Samira, your student nurse for today. May I know your name and your birth date, ma'am?
Kim Abigail Bain, April 30, 2000.
So today, I'm going to perform physical examination about comprehensive geriatric assessment. But before anything else, I'm going to close the curtain first to provide privacy. Okay, ma'am, can I ask you some questions if it's okay?
Sure.
Do you have any history about allergies?
No.
How about surgeries?
No.
Okay, let's proceed. So now I'm going to assess your skin color, if there's any signs of lesions, the uniformity, if it is well moisturized, and your skin turgor. Your skin color is light brown and even. It is well moisturized, and the uniformity is normal. No signs of any lesions, but you have some flat moles. Can I pinch your skin? So it springs back to its previous state, so it is normal. Next is, I'm going to assess your nails. The nail texture, the plate shape, and the nail bed color. So your nail texture is smooth, the plate shape is in curvature shape, and the nail bed color is pinkish, which is normal. So now I'm going to inspect your head. Okay, so your hair is evenly distributed to your scalp. Your hair is smooth and thick, and there is no signs of lice or any kinds of infections. Okay, so now I'm going to assess your scalp. Okay, so as I inspect your skull, the shape is rounded normocephalic and it is symmetrical. And as I palpate your skull, it is smooth and there is no signs of nodules, masses, and other depressions. And you have a symmetrical facial movement. We're on assessing the eye structure and your visual acuity. So, your eyebrows are evenly distributed. And can you blink, ma'am? Your lid closed symmetrically. Can you smile? You have a symmetrical facial movement. So, and your cornea is shiny and smooth. The details of your iris are visible. And the pupils are black and symmetrical, and it is flat and round. Next is the reaction of your eyes to the light. So I'm going to use this pen light. Your pupil constricted when it is hit by the light, therefore it is normal. So now, can you follow the direction of this pen as I move it? So your pupil constrict as I move it forward to your face, dilated as I move it backward, and converge as I move it closer to your nose. Now we're on assessing your ears. So the color of your ears is the same with the color of your face. There is no signs of masses or lesions. Can you repeat what I said?
Hi.
Hello.
Hello.
Okay, so now I'm going to assess your nose. So upon inspecting your nose, it is symmetrical and straight, and it is uniform in color, not tender, and there's no signs of any lesions. Can you breathe in your left hole of your nose? How about in the right? Did you breathe well? Good. So the air movement restricted to your both nares as you breathe. That means that it's normal. We're on assessing your mouth and your oropharynx, but before that, I'm going to use these gloves to avoid contamination. So first, I'm going to inspect your lips and your buccal mucosa. Okay. So the color of your lips is uniform pink. And can you please open your mouth, ma'am? The color of your buccal mucosa is also pink, which is normal. So next is I'm going to inspect your teeth and your gums. Can you please show your teeth? So the color of your teeth is yellowish and smooth, and you have smooth tooth animal, which is normal. And can you please open your mouth? The color of your gums is pinkish, which is also normal. Okay, can you show me your tongue and the bed of your tongue, ma'am? Bed of your tongue. Okay, so your tongue moves freely and has no tenderness and in central position. Can you open again your mouth, ma'am? So your oropharynx and your tonsil is color pink and has smooth posterior wall. Now I am going to assess your neck. First, I'm going to inspect your neck muscle. So as I inspected your neck muscle, I observed that it is equal in size and it is head-centered. Now, can you please move your head to the right, to the left, up, and down? Okay. So as you move your head, I observed that the movement is coordinated. The movement coordinated smoothly with no discomfort. So can I palpate your thyroid glands? If it's okay. So as I palpate your thyroid glands, there are no signs of masses, which means that it is normal. So now we're on assessing your thorax and lungs. So assuming that my patient has no clothes on, first I'm going to inspect your thorax in posterior to lateral view. Okay, so as I inspect your thorax, your chest is symmetrical. You have some moles. There are no signs of abnormalities. And the color of your skin is even. Now I'm going to palpate your posterior thorax. So as I palpated your posterior thorax, there are no signs of abnormalities or any lesions. Your skin is well moisturized and there are no signs of tenderness or any masses, which means that it is normal. Now, I'm going to palpate your posterior thorax for respiratory excursion. Ma'am, can you please breathe? Breathe out. Okay, so as you breathe in and breathe out, my hands move symmetrically. That means that it is normal. So now I'm going to inspect your anterior thorax. Okay, Very good. There are no signs of deformities. And now I'm going to use this stethoscope for auscultation. Can you breathe using your mouth, ma'am? Very good. So as I auscultate your posterior thorax, I didn't hear any abnormal sounds. That means that it is normal. Now we're on assessing the abdomen. So assuming that my patient has no clothes on. So now I'm going to inspect your abdomen for skin integrity and for contour and symmetry. So your skin is unblemished and uniform color, and the contour and symmetry is flat and rounded concave. Now I'm going to auscultate for vowel sounds. Okay, so upon auscultating your abdomen, I can hear some audible sounds, which means that it is normal. So now I'm going to palpate your liver. Please tell me if it is painful. So the liver is in normal condition. Let's proceed to our last assessment, which is the musculoskeletal. Now I am going to inspect your muscles. Okay, so your muscle size is equal. Next is I'm going to inspect your joints. Upon inspecting your joints, there's no sign of swelling, and the last part is to palpate your bones. So upon palpating your bones, there's no signs of edema, tenderness, and nodules, which means that it's normal. So thank you for cooperating to my geriatric assessment. That's all.